Mulago Hospital is currently treating over 300 active cases of COVID-19. However, some of those admitted there claim they were never presented with the positive results on admission to date.
I was admitted to Mulago Hospital on the 29th of August on the basis that I had tested positive for COVID-19. But the thing is, I hadn't gotten my results. Then at around 7 p.m. I get a call that an ambulance is coming to pick me and take me to Mulago Hospital, which I didn't object. So when they came and brought me here, the interesting bit is even the ambulance people actually didn't have my results, because they were asked where my results are, and they said they will look for them, and I was dropped in, and up to now I don't know what exactly I tested or what result I returned from the first test. But the thing is also, when you get in, they actually retain you on the basis of you have been exposed already, so they can't let you go out, basically.
A patient only goes to an isolation center when the results have been accessed and they've been put in the results dispatch system, and a printout is done for the evacuation team.
Lubwama, not his real name, further says there was little effort towards retrieving information from him regarding possible contacts.
Once we got here, only few questions and not serious interest was made when asking about family members, that is, if we have been living with them. But there was never any follow-up on contacts or even any conversation about contacts.
Inside the hospital, the patients are seen exercising and others holding a prayer session. On the outside, the Red Top, a military branch of the UPDF, keeps guard. Many of those inside say they have no access to counseling sessions, as Lubwama narrates.
I've been seeing some new people or new faces that have been brought in, and they look confused, they look worried, they look scared.
Another patient receiving treatment corroborates Lubwama's account.
Everyone who was coming in was so much stressed. People were despaired. They didn't know where to go. They didn't know what to do. They didn't know who to ask. So I showed up myself and I started helping out. I'm collecting for them lunch, breakfast, supper, and evening tea.
On Friday, while the Minister for Health, Dr. Jane Ruth Achenga, and her team addressed the media, she said nobody has been admitted wrongfully. However, most cases on admission are mild.
I didn't believe because I didn't have any signs, but I was told I might be asymptomatic, so that's when I started believing. Psychologically, of course, it tortures you to be normal, you're sick at the same time, but I had to take it because I would trust the labs where this test has been done.
The public is hereby advised that if you test positive for COVID-19, whether you have signs and symptoms or not, we encourage you to take the test as truly positive and take all the precautionary measures to prevent the spread of the disease.
The government owes us to give us the exact results. For example, we think they have better labs to give us positive if the person is really positive and negative if the person is really negative.
In another ward, Umaru Seruuza, who allowed to speak on camera, says the health workers are somewhat negligent while on duty. A health worker who did not want to be disclosed told me they have not received some of their allowances.
We have had a change in financial years and transfer of funds to the respective accounts. Usually, money goes to the respective accounts by the second week when you transfer, when you change a financial year. So there could have been a gap in the first 2 weeks, but money is now available in the respective accounts. except for the regional referral hospitals that the permanent secretary is handling, because specifically the money for the allowances has not yet been dispatched.
A COVID-19 patient spends an average maximum of 21 days and minimum of 14 days on admission and thereafter discharged after full recovery. Previously, 2 tests in a space of 8 days were taken from those on treatment. However, Lubwama says the instructions have since changed.
So I had another test on Wednesday this week or last week, and I'm still waiting for the results. And the new policy here is if you return a negative test, then you can actually be allowed to go home. If you return a positive test, then they can actually administer, or they will carry out a second test.
This is from the case management pillar. It is informed by data, trying to reduce the stay of the COVID-19 patients on the ward. Because of the results that we are coming back from the laboratories, they were informed by data that at that time most people were still positive, so it was shifted to day 10, and we are watching to see the data that comes out of that.
It remains imperative for the Ministry of Health to ensure a clean bill of health in all aspects while handling COVID-19. Walter Mwesije, NTV.